good wishes to you all. I'm Dr. Dishan. I'm here to talk about asthma, an awareness program regarding asthma. This is on behalf of our IMA Marthandam branch. Asthma is a chronic disease that affects the airway of your lungs, and that's why they are always called as airway diseases. Asthma is generally hereditary, which means it passes through families. It does not spread from one person to other persons. Symptoms of asthma may develop at any age group and commonly from birth to around 40 years of age group. Asthma is treatable and you can keep your asthma symptoms well under control. Asthma is not an illness which is to be scared. What happens when you have asthma? Normally, airways are not swollen and the air passes easily through them. In asthma, the airways are swollen, narrow and filled with mucus, which makes your airways tight and air gets trapped in the alveoli. So breathing becomes difficult, and this is because of inflammation in the airways. Thus, patients develop episodes of coughing, breathing difficulty and wheezing. What are the causes of asthma? It is more common in a family history with asthma or allergy. The common trigger factors are some pollens from flowers, weeds, trees, grass, mold, cockroach droppings, animal dander, hairs of pets like cat and dog. Here, the cockroach droppings are very important because we don't much mind about that actually. These symptoms can cause sneezing, wheezing, itchy eyes and a running nose. Dust mites are also common and is an important risk factor which is very common in most of the houses. Also, inhaling chemicals which are present in pesticides, insecticides, paints, garden sprays, the perfumes which we use regularly, colognes, hairsprays, and the deodorants, and the cleaning products which we use for cleaning our floors or walls and bathrooms. These can also trigger the asthma symptoms. Also, exposure to cigarette smoke is an important trigger to asthma. Cigarette smoke not only directly increases the risk of asthma, but also can make a person more prone to viral infections and makes the airways more sensitive. And there are also some occupational factors or occupational risk factors. The occupational risk factors are commonly like grains, flours, cleaning agents, metals, irritants, and some woods, etc. And coming to the next thing, that is overweight and obesity. Incidence of asthma is very high among patients who have overweight and obesity. Next coming to the viral infections. There are some viral infections which can cause common cold and can trigger the asthma symptoms. Next, the unnoticed or an important trigger factor can be a GERD, that is a gastroesophageal reflux disorder, a disease in which there is a possibility of regurgitation of stomach contents into the airways, and that can also trigger the asthma symptoms. And other trigger factors can also include stress, exercises and air pollution. Here, the stress and exercise also doesn't much get noticed by the normal people actually. Now coming to the symptoms. What type of symptoms asthma can produce? Commonly the symptoms which can produce asthma symptoms are wheezing, chest tightness and cough. You may have some in few days, or in some days you may not have any symptoms, and other days you may have some symptoms. When you have asthma symptoms, you may feel like you are breathing through a straw. You feel very difficulty in breathing. And then you may also hear wheezing sounds as air tries to pass in through your narrowed airways. And the next common symptom is cough, which is most commonly seen during the night or in the early morning. Next common condition or common symptom is the chest pain. Chest pain or feeling like a chest pressure or feeling a chest tightness. And these conditions can make you feel anxious or scared. And feeling scared or feeling anxious can also make you feel very uncomfortable and make increasing your shortness of breathness. Asthma cannot be diagnosed without a breathing test. Breathing test is the common test which we use for asthma actually. So the commonest test is pulmonary function test. So when you go to your doctor will advise you a pulmonary function test, or it's otherwise called as spirometry test. There are many types of asthma and many different things that can cause asthma or appear to be an asthma appear to be like asthma, similar to asthma. Okay, so your doctor will know exactly what to be done. Okay, so in addition to the spirometry or pulmonary function test, he may add you some additional tests like blood test for knowing allergies, for detecting allergies or any other immune problems, to get detected or any other immune system problems. Okay, so coming to the treatment of asthma. Okay, after diagnosing asthma, then we have to come for the treatment of asthma. Okay, so once you are diagnosed with asthma, it is very important that you work closely with your doctor to control your asthma. Okay, so you are supposed to discuss with your doctor, and your doctor will make an action plan. Okay, it's an action plan. The action plan has treatments and how to improve your quality of life. Okay, so your action plan will include when to take your medications, what you can do in your daily life to avoid triggers, and how to monitor your breathing, and also medications. Okay, so medications will be prescribed according to your presentation of symptoms, as different patients, or as most of the patients will have unique presentations, okay, based on the trigger factors. Medications will be prescribed to keep the airways open and reduce the swelling, so that the air can move very easily, or move in and out very easily, so that you feel less chest discomfort, and you feel less breathlessness, and your cough symptoms will come down. Okay. Actually, when you use the medications correctly, you should be able to prevent your asthma symptoms, and you can lead a normal life. No longer, actually, we don't use a long-acting bronchodilators nowadays. We use both steroids along with bronchodilators to control the asthma symptoms. Okay, so these medications must be taken on regular basis and are designed to keep your airways open over the time. Okay, so basically steroids will decrease the swelling in your airways, so that they are less likely to be irritated by the triggers. Okay, and then since asthma is an airway disease, inhaled steroids will be the best way to be chosen. Okay, as it causes less sedative, less side effects. Okay, less adverse effects or side effects than the oral steroids. Also, it acts very fastly in the airways by arresting the inflammation and can cause which causes the bronchial constriction. Okay. So along with steroids, we use the long-acting bronchodilators, which will dilate your bronchi and keep you to feel free in breathing. So nowadays we have common inhalers which have both the long-acting bronchodilators and the steroids along with them. Okay. And other medications are like oral drugs, including leukotrienes modifying drugs like montelukast, safirlukast, and theophylline also can be added if required. If required, this also can be added. Okay, these drugs are not usually as effective as corticosteroids and long-acting bronchodilators. Okay, so it is always advisable to start with an inhaler which should have one long-acting bronchodilator and one steroid. Okay, and it's very, very important to have a good inhaler technique, because it is important that you properly use inhaler to ensure that the drug reaches the lungs properly. If you don't have a good inhaler technique, and if you don't use the inhaler properly, then there is no use in taking the medications actually. Okay, now other than drugs, okay, how to have a lifestyle management which helps you in asthma. Okay, so the lifestyle management begins with learning what specific triggers may be causing the asthma symptoms. Okay, it should begin with the learning about the what specific triggers can cause your asthma symptoms. Okay, so we can advise our patients to keep a diary. Okay, so that you can daily track your day-to-day activities along with any symptoms that may be having during the day or at the night. Once we know that what may be causing your asthma in our patients, we can act accordingly, and we can advise them to stay away from those triggers. Okay, so it will be easy for the patients and for the doctor to make a systematic action plan. Okay, now there is a technique, there is something called as peak flow monitoring. Okay, this is also been recommended. This is by blowing into your peak flow meter each day, we can track how well they are been breathing. Okay, or how our patients have been breathing. Okay, sometimes the peak flow reading will show you good, very high, so that you are in a normal, maybe in you are without any symptoms. Okay, sometimes that can also show you low when you have a worsening asthma symptoms. Okay, so when peak flow reading is lower, it is always good to increase the medications by the advice of the doctor. Okay, the goal of peak flow monitoring is to help guide them prevent an asthma attack. Okay, it is not a treatment of choice, but it is only to monitor and guide to prevent an asthma attack. Okay. Now, what are the action steps we can do? Okay, what are the action steps we can have for it? It is to develop a written asthma action plan as prescribed by your doctor. Okay, to get the most benefit from your inhalers, be sure that you are using them correctly by showing your doctor how you use the inhalers. Okay, the technique, the way how you use. Okay, you are not supposed to tell, but instead you are supposed to act and show how you take your inhalers. Okay. Then, have your relief, always have your relief or rescuing inhaler with you all the times whenever you go out. Okay. Knowing your asthma triggers and take steps to avoid all the measures or steps to minimize the exposure from them. Okay. Always see your doctor whenever you have symptoms, and it is advisable always to visit your doctors at least once in 2 months, and also you are supposed to make action plans according to the diary steps what you have. And it is always better to have a repeated pulmonary function test or a spirometry once in 2 years or once in every year. And what about the diet? Okay, now coming to talking about the diet in asthma. Okay, there are some dietary changes that can be helpful in asthma management. Okay, usually we advise to take a vitamin rich A. Okay, vitamin A, vitamin D, and vitamin E rich foods. Okay, vitamin A and D helps to fight the inflammation and allergy. Okay, so it's which are the characteristics of the asthma. Okay, and vitamin E, that is an antioxidant. Okay, it acts as an antioxidant and it also helps in fighting inflammation. So always we advise to take a vitamin E, vitamin A, vitamin D rich foods. Now coming to exercise in asthma, we always suggest a breathing exercise. Okay, especially those which involve holding breath. Okay, holding breath, that will be very helpful for the asthma patients. Okay, breathing exercises are done only to decrease the rate and volume of breathing, to increase use of abdominal muscles, also to improve the chest movements, and also to have a relaxation. Okay, breathing exercises are not the treatment of choice, but it is only to improve the quality of the life. Okay, it is improve the quality of life. Okay, now what can the breathing exercise benefits you? Okay, breathing exercise benefits you by decreasing overbreathing, decreasing breathlessness, and decreasing inflammation, and also decreasing the changes in pattern of breathing and decreasing anxiety. Okay. So what are the common breathing exercises we advise? One is pursed lip breathing, another one is diaphragmatic breathing, and the third one is inspiratory muscle training. Okay, commonly here we always advise all the patient to do a pursed lip breathing, which is very easy and it's very simple. Okay, pursed lip breathing is nothing. You just sit upright, breathe in through your nose. Okay, breathe in through your nose and slowly breathe out by making pursed lip. Okay, there is like take in and then breathe out through your lips. Okay, right. The duration which you breathe out should be twice more than the inhalation. Okay, so the duration which you breathe out should be at least twice than the breathing inside. Okay, this technique helps you to decrease number of breaths taken in and keeps the airways open for a longer duration. Okay, so this is about the pursed lip breathing. Now coming to the diaphragmatic breathing. Okay, diaphragmatic breathing, you are supposed to lie down in a bed. Okay, and you are supposed to lie down and relax gently, placing your hands on your abdomen or belly. Okay, and then you breathe in slowly through your nose and then breathe out slowly through your nose. Okay, breathing usually through your belly and not instead of your chest. Okay, so you should always observe by keeping your keeping your hands in your abdomen, so that whether it's rising and falling, to see your belly rising and fall. Okay, remember you should not use your chest to breathe. Instead you are using your belly to or abdomen to breathe. Okay, so this keeps your shoulders, chest and neck relaxed while doing the exercises. Okay, next one is the third one is the simple thing. There is a inspiratory muscle training. Okay, so keep your muscles strengthened. So strengthen your inspiratory muscles. Okay, we aim to increase and this stamina. Okay, strengthen stamina of the accessory respiratory muscles, because these accessory respiratory muscles will help you when you have an exacerbation. They help you more in during the breathing. Okay, so this inspiratory muscle training will help you to keep your muscles strengthened, and it's to improve your quality of life. And last but not the least, coping with stress. As I told you earlier, stress is one of the very common trigger factor which we never notice actually. Okay, so always learn new ways to cope up the stress, and coping with stress can prevent and control your asthma. And always do remember, if you have any symptoms or if you have any exacerbations, always feel free to discuss with your doctor and make your action plan. Okay, thank you.